So, so I'm Grace Whiting. I'm the president and CEO of the National Alliance for Caregiving. I'm very excited to talk with all of you today for our town hall meeting. And we're going to start with just some introductions about who NAC is, about the Adira Foundation, and then we're going to go into a discussion about caregiving as a public health issue, really thinking about what does it mean to try to care for someone with a healthcare need or a disability in the midst of COVID-19. In 1996, the National Alliance for Caregiving was established as a nonprofit organization. We're based in the Washington, D.C. area, and we're a coalition, which means that our mission is really to build partnerships in research, advocacy, and innovation so that we can make life better for family caregivers. And we do that by working with other people who care about caregiving, whether that's nonprofit organizations, corporations, foundations, federal agencies, as well as advocates and real people who are impacted by caregiving. Now, if you'll go on to the next slide, I want to introduce to you the Adira Foundation. And we have colleagues from the Adira Foundation who are on today. My co-captain of today's meeting is Greg Smiley, who's the CEO at the Adira Foundation. But I also just want to acknowledge both Marilyn and Lauren at the Adira Foundation and Kelly, who have been working with us on this project. So if y'all want to wave or pop up an emoji, it'd be great to do that. And then Greg, I'm going to hand the baton to you to just give a little background on the Adira Foundation.
Sure, Grace, and thanks. And thanks for pulling this together. It is a very needed issue to gain so much more attention. We're pleased to be a part of it today. Adira Foundation is a brand new organization. This is our inaugural year of programming. It's really, the mission is to invest in better lives for people with neurodegenerative diseases. The broader vision, though, is about working on complex care and those diseases that necessitate the person going through healthcare to think about a dozen or more issues at the same time. And as many of us know, just from perhaps less consequential diagnoses, going through healthcare, of course, is challenging even for the healthiest of us. And there are a number of different nonprofits that have arisen up around the country to help people with neurodegenerative and other diseases, but they can't absorb, they don't have the capacity to take on all of those larger issues that people dealing with complex illnesses need. And what we're doing is trying to assemble a larger family, a larger universe of patients and caregivers to ask them what are the most pressing issues that the typical nonprofits, while great, aren't able to help with, what keeps rising to the top, what is relatively unowned by any sector or donor or patient group because it's just too large and too cross-cutting. And we'll look to fund and program to that. And that's what's been so exciting about working with Grace and the team at the Alliance, because caregiving consistently rises to the top of that list. It is something that is pervasive no matter who you are or what you're dealing with, and the needs on caregivers is exponentially growing. They are expected to do far more, and they're expected to do it with less. The demands on the people that they're helping have increased. The demands on themselves have risen exponentially, and the services that might be available, which were already bone thin or spread too far already, are really falling out of reach. And so we're, through this discussion today, hoping to talk about that and talk about not only what your experiences as caregivers are and some of the insights that you might have. Again, please go back down to the chat and list any particular resources that you found helpful so that we can bank that as part of our arsenal of ways that we can learn more and share more. But beyond that, we also need to talk about caregiving as a public health issue and how we, not only as individuals, but as systems, need to find additional services, additional appropriations, additional efforts to caregiving. And we've had a number of different institutions that have been working on the research of caregiving and finding new ways to provide more service, better service, or to expand the attention to this is a vital issue. And we're so fortunate to have three of those institutions represented by their leaders today to speak about the research that they've learned, not only over the past dozens of years, but just in the last 9 months, specifically how COVID-19 has exponentially exacerbated the problem. And if you'd like, I can introduce the panelists now. I think that we wanted to hear from them, a lot less from me, and then again later on from all of you. So.
Well, and Greg, if you want, I'm happy to provide just a brief overview of the project. Sure.
That would be great.
Yeah, so we have partnered at the National Alliance for Caregiving with the Adira Foundation to create a new resource for caregivers. And what we're trying to do is to make it easy for people to navigate services and information within the context of the COVID-19 pandemic that we're currently experiencing. So today, Greg and colleagues are going to give us some overview, some food for thought on what is it that we should be thinking about when it comes to caregiving and COVID-19. And then we'll take a short break, and then we'll come back into breakout rooms where we want to hear from you. In those breakout rooms, we'll be discussing a framework for describing COVID-19 and caregiving. The first is a framework so that we can really talk to policymakers. Hey, policymakers, hey, innovators, hey, businesses, this is what we need to do to make life better for caregivers. And here are the pain points and those pressures that we're really seeing. The second part of this is for us to stand up a new resource where people can actually provide input and give their feedback on the framework, and also help us organize information for caregivers so that we can make it easier for them to navigate, so that it's not so crazy to try to find out, okay, I need help with work or I need help with respite. Where am I going to find that? So I'm thinking of this like the Wikipedia of caregiving. I do want to acknowledge that we have people on this call today who are actually on our steering committee. So again, coming back to that idea of partnerships, we are not by any means the only people who know things about caregiving. So we've tried to enlist other people who are smarter than us, who are excited and got great ideas to inform what we're doing on the steering committee. So if you're on the steering committee, if you want to just either throw up an emoji or wave if you want to be old school. I know Maddie Mason at National Health Council, who did awesome emoji. Thank you, Maddie. We've got David from Clara Health. We've got Jennifer Levin from Caregiver Collective. We've got Trish D'Antonio from GSA. Thank you, Trish. And I'm looking at all my Hollywood Squares. Emily Scahill from Mental Health America. And is there anybody that I have forgotten that's also on this? Charlotte, I think we're good. Okay, so with that, let's talk science. And I just want to say a quick intro for the great panel that's going to be on. So if you'll go to the next slide, just so y'all know who's going to be talking. And let's see the next slide with our distinguished speakers. Gosh, I could not be more excited. First off, Greg, I think was being a little bit modest, but he's really the founder and the innovator behind the Adira Foundation, and really trying to rethink how we talk about caregiving, particularly when it comes to neurological disorders. And I think is coming from the experience of having been a consumer of the healthcare system and taking that and thinking about how do we actually bring people together who can move forward a better way to move across healthcare systems. Then I am super thrilled to share folks on the panel who've done research on caregiving. So Jasmine Greenmeyer, who is at EMD Serrano, is the Vice President and Head of Global Strategic Partnerships. So what does that mean? So that means that Jasmine actually leads a caregiving and Healthy Women, Healthy Economies initiative for a global company. And in doing that work has built on several years of experience as a patient advocacy specialist and working on topics such as oncology and fertility. She's done a lot of work over the years in public health, And she continually works with global partners to really advocate for women and for caregivers in that role. She's also worked on the nonprofit side for the Colorectal Cancer Alliance for 8 years. She's worked at the CDC and at the NIH. And in addition to her Bachelor of Arts from Michigan State University, she has a Master's of Public Health from the University of Michigan. So very excited to have Jasmine. We also have Dr. Jennifer Olsen, who is the Executive Director of the Rosalind Carter Institute for Caregivers, which is the longest standing family caregiving institution in the United States. And she's an epidemiologist. So what an exciting time to be living in a pandemic, having studied epidemiology. And we are so thankful for her insight and her leadership at RCI. She has also managed the Ending Pandemics in Our Lifetime initiative at the Skoll Global Threats Fund. She's, in addition to that, worked in a lot of community work around the world, helped to spread disease, and created what was called the EpiHack process, which was a hackathon style event using technologists and public health experts to really think about how we improve public health. Her bachelor's is in biomathematics from Rutgers, which sounds exciting and also intimidating. And she has an MPH in epidemiology and a Dr. PH from the University of North Carolina. And our third speaker, Heidi Donovan, is a PhD and a nurse. She is a professor of nursing and medicine at the University of Pittsburgh. She's the director of the Gynecologic Oncology Family Care Center and also works at the hospital at UPMC. She is currently the principal investigator and co-director of the first National Center on Family Support, which is funded by the Administration for Community Living, and is really a very powerful collaborative of researchers and advocates to collect better information on the caregiving experience. And she's the co-founder and director of the Family Care Center at the McGee Women's Hospital of the University of Pittsburgh Medical Center. So we have a very distinguished panel. I'm going to hand it over to Greg, who's going to kick off our conversation. And just to signal in terms of time, I know we're at about 3:20 now. So we're going to have a conversation till about 3:40, 3:50. Then we'll take a quick break and then we'll come back and go into the breakout rooms. So Greg, I'm going to hand the baton back over to you. And Charlotte, if you want to just keep the slide up, folks can also connect with your speakers using the Twitter hashtags below, and you can insert questions into the chat box and comments, ideas as people are discussing.
Yeah, that would be great. Jasmine, would you mind if we started with you, since you're first up here, and I believe you're the next slide. Jasmine, if you would perhaps share additional information on yourself that you would like us to know. We certainly want to hear quite a bit about this index, because it was quite exciting to read. That maybe we can possibly set aside tools and metrics to figure out how to compare apples to apples over time to how different entities are doing, different individual caregivers are doing. May I kick it over to you to introduce yourself and your slide?
Sure, Greg. Thank you and Grace both for this invitation too. First, I want to step back. Even though I'm representing EMD Serono, this report that we just launched, actually November 18th, was in partnership with our Embracing Carers advisors, and it's 9 of the leading global organizations that address unpaid caregiving. And I have to thank Grace. She's one of the key contributors with NAC at large. And so this past spring, when we were looking at, just the world and what was going on and how to contribute to the caregiving space, we quickly coalesced around the impact of COVID-19 specifically. And we released the US results, as I alluded to, just last month, but this is actually going to be the US as part of 11 other countries that we're going to be looking at on a report that we're going to be releasing at the beginning of 2021, where that looks at EU countries, APEC countries, Brazil as well, just to get a more global snapshot. But within the US, the reason I chose this slide in particular is because I think there is a direct line to potential policy support that could be happening for unpaid caregivers. So if you wouldn't mind, I'd just like to talk about that a little bit. You know, what I was really struck by in this slide was the percent of caregivers that indicated they're spending their own resources, you know, particularly on items like PPE, where you see over, you know, close to half here indicating that, and also the percent that indicated that caregiving in the pandemic is affecting their financial status directly or indirectly. And then obviously, if you go another layer here that's not directly represented on this slide, when we talk about the financial impact, you know, to unpaid caregivers, women and communities of color are disproportionately affected. You know, we know it's been well reported, right, that women and women of color particularly have lost their jobs. And we know that mothers of all colors have had childcare affect their employment status in staggering ways. But then you add to this, right, that we know that women do the majority of unpaid caregiving for our loved ones. And what we saw right away in the report is that the hours spent on unpaid caregiving has increased significantly. And then you exacerbate these issues with the fact that women caregivers are significantly more likely to be lower income and a need for additional financial tools and resources. For example, we saw that 56% of women have a reported income below $50,000 compared to men at 36%. And then again, if you look at communities of color, in our report, it was 28% reported that their financial health had worsened here. So you look at the difference in the average compared to, again, communities of color. And to their white counterparts, it's a 28% to 14%. That's a significant 2-to-1 ratio in my mind. So again, this raises the question, if we as a society are relying on unpaid caregivers to help our loved ones with chronic health conditions, how can we better support them? And I think this information, you know, helps build the case for, you know, amending federal tax policies, you know, whether that's tax credits or looking at increasing the deductibles. I also think there's a case here for providing subsidy payments or similar to what we do with unemployment or Social Security to help offset the cost of caregiving. And I think this also rounds out nicely the drumbeat around creating a national mandate for paid leave. So I didn't know, Craig, Greg, if there was anything else that you wanted me to comment on here.
Well, I hope that we will bring you back, because I want to talk about those, you know, those 5 key themes again. You mentioned them briefly, but it would be great to bring them back in a minute. Maybe we can go to Jen Olsen at the Rosalind Carter, let me get this right, Rosalind Carter Center Institute for Caregivers, not caregiving, Rosalind Carter Institute for Caregivers. Did I get it right?
That's right. We're like 20 hours in. So thank you for helping us adapt to that change. And thank you, Greg and Grace, for the chance to speak today about our Caregivers in Crisis report. This is something we had set out to work on earlier this year when we had been hearing from caregivers that we have been serving through coaching programs. We have a number of one-on-one coaching initiatives. And we've been hearing about actually financial strain. So it's great that I'm going after Jasmine. We've been hearing about financial strain. We've been hearing about concerns about access to services, a variety of issues. And had just wanted to understand, like, where were those biggest challenge points across the board? Unsurprisingly, I guess, the result was very much focused on the stress and mental health impacts of caregiving during the time of COVID, far surpassing what we thought were the more kind of logistical challenges that the crisis was presenting. But what I wanted to show with this slide is that, you know, I don't think it's terribly surprising that pre and post, you know, the start of COVID, there was a decrease in available services, you know, kind of the reduction in availability of various types of respite and increase in the use of telehealth. all of those things were true. But maybe the bigger point here is that we surveyed over 400 people, and those blue lines never get anywhere near 400. So I think the bigger question for me is that it isn't as much, how much worse has it gotten post-COVID, but what was the real set of challenges across the board, despite having, a number of services that people know of or maybe have awareness about. There's still so many challenges with access, with availability, with resources to cover those, with knowledge about where and what exists across all of these opportunities. So maybe, if there was a silver lining here, it's that there's room for growth in all of these. If we could get, 100% of caregivers the services that they're looking for, both through kind of policy and innovation opportunities. The other thing that our work pointed out, and that I think is kind of telling, was that while many caregivers spoke about being what we called stuck together and torn apart, there was a lot of these kind of descriptions of household situations where what was previously the moment of respite, the drive to the grocery store, or the chance to walk around and run errands, was no longer available. That kind of increased time together, which resulted in reduced kind of intimacy or changes in relationships between the caregiver and care recipient, was coming through, all presenting as different stress factors that caregivers were experiencing. And this actually reminds me of something I learned from President and Mrs. Carter on their 73rd wedding anniversary. Someone asked them, what's the secret to long marriage? And they said, time apart. And so I'm not terribly surprised that our work showed that, successful relationships require individual hobbies or time apart, but that this kind of COVID experience of not having that space was causing a lot of these mental health challenges, and that added on top of the lack of services or the inability to make those get out of the house for various things by either party, the caregiver or the care recipient, was causing increased stress and challenge. So I think that in and of itself is something we'll continue to watch over the course of the next few months, as people, especially in colder climates, don't have as much of that time apart as they might need.
Yeah, I mean, it's fascinating work, and I feel bad that we aren't able to go through the entire sets of all of the data that could be well reflected. Hopefully we can discuss later about how people on the call, but the public at large might be able to access the full reports of each of these. But just having RCI's voice as an anchor to this, because as that trusted resource for policymakers, but also individuals, I think will be a leading voice in that charge for more awareness, more resources, better services. Maybe I can pull in Heidi now, who is not only working on the research angle, but the training piece as well, from the university, from Pitt, part of the rehabilitation and training center, perhaps as the co-executive director, co-leader there. Heidi, do you mind bringing us up to date on what your recent research?
Sure. Yeah, so thank you very much, and thanks for the privilege of being here for this discussion. I'm really happy to be a part of this. So this is a survey that we did from our center, spearheaded by one of my co-directors, Scott Beach, and Rich Schultz, who also is a key player in our center. So we did a survey. This was actually run early in the pandemic. We didn't know at the time that it would really be considered so early in the pandemic. So this was April and May. So the first peak really of the pandemic. And I think the strength that our survey brings, and it's really exciting to see how complementary these different reports are. So we actually surveyed about 3,000 non-caregivers and approximately 600 caregivers for this survey. And I'm going to walk you through this slide. I know it's a little bit, this was me trying to sneak in 3 slides on 1 slide, but I think it tells the story that I was wanting to tell. So the first one is that, like you've already heard, the COVID pandemic has made family caregiving more challenging. So something that was already challenging has now become more challenging. So these set of items, which we actually call the COVID Caregiver Risk Index, it was 12 items that really asked directly, has the coronavirus had any of the following impacts on you and your care recipient? So there are 12 items, people would answer yes or no. And what we found is that, in decreasing order here, about 63% of caregivers said that their caregiving duties had increased. And I think that was really well documented there by Jennifer on the previous slide about all the reasons that, they had to take on more duties while the other supports went away during the pandemic. They talked about the care being more emotionally difficult. So 56% of them said yes to that. In the 40s, there was the increased care recipient mental health issues. So the people they were caring for were really struggling as well with the isolation. They said it was harder to get food and supplies like medicines, interfered with the care recipient's health care. There were changes in who provided care. And they talked about care being more physically difficult, more financially difficult, and it interfered with their own caregiver health care. So those were some of the features of how the pandemic had changed the caregiving context. The second piece is that because we had this caregiver sample and a non-caregiving sample, and we chose some measures, they're called the promise measures, that have well-established population norms. So we know what the population looks like in general. So that actually gave us some pre-pandemic population norms that we could compare both our caregivers to and our non-caregivers to. So what we found here is that as expected, as everyone feels, this COVID pandemic is hard, right? Everybody's struggling during the pandemic. Everybody's a little more anxious, a little bit more depressed, a little bit more fatigued, some sleep problems, and we're not doing the social participation that we all need desperately. So even non-caregivers, we're affected compared to pre-pandemic levels in all areas except for fatigue. Maybe, people are hanging around their homes more, right? But if we look at it, caregivers have even more, even once again, more on top of that, more anxiety, more depression, more fatigue, more sleep problems, and poor social participation. These were statistically significant differences between caregivers and non-caregivers, and meaningful differences from pre-pandemic norms. So I think one of the important things, the information on the left really are very caregiving specific impacts. These on the right here are, really general measures of, reliable measures of general anxiety, general depression, general fatigue, sleep problems, which we know if they remain at these levels puts people at risk for physical health problems down the line. And I always, I think we spend a lot of time talking about the caregivers of today are really at risk if they're not supported to becoming the next care recipients, the next generation of care recipients. So I think this is really, really important. And then my final statement is that when we looked at predictors of these poor and meaningful health outcomes, we found that the number of caregiving challenges or caregiving impacts related to COVID was a strong predictor of increasing levels of each of these poor outcomes. So the higher the number of challenges here, the more likely caregivers were to score higher on anxiety, depression, fatigue, and sleep problems, and have less social participation. So that's where we, have termed this the COVID Caregiving Risk Index. We feel like these items really sort of are predictors of potential poor outcomes for caregivers. I would also add that, within these are additional risk factors, and in ours on multiple measures, the other risk factors in addition to these contexts are younger caregivers, caregivers who are caring for individuals with emotional, behavioral, cognitive, memory issues, those who are providing both personal and medical type care, younger caregivers, and the one that stood out for us was really lower income caregivers or at higher risk for poor outcomes across the board. So,
I mean, it's fascinating to see it all, in this representation of the 12, and probably that's just a drop in the bucket with the issues that people will present as problems, but seeing that those repeated again and again, it seems it echoes. If I can go back to you, Jasmine, it echoes the themes that were coming up in Embracing Care's report, with the rise in demand, the change in responsibilities, the increase in disparities. Maybe you can speak to that and the global priorities that you have been championing. Hard to say quickly.
No worries. Yeah, Greg, I totally agree. And thank you for alluding to the 5 categories that we specifically looked in the comprehensive report. And it's so fresh, I'm looking right at it to make sure I get it. You said rising demands, change responsibilities, the toll on caregivers, the inequities in caregivers, and also we spent time beating the drum on path to solutions, looking at both short-term, those that are highly relevant to the COVID and pandemic elements, but also more long-term solutions. Because as we know, and we've all said it here, that the pandemic has just exacerbated pre-existing tensions. It's just elevated all the concerns, right? But we were particularly struck around the mental health aspect, that everyone's alluded to here, and just that was the most seismic increase that we saw. I mean, 3 to 5-fold, depending on the categories. Actually, everyone else also alluded to the fact of new caregivers, that weren't caregivers prior to the pandemic, and just the possibilities there for interventions, particularly to help support millennials and Gen Zs who also expressed higher anxiety and higher depression rates. So I think there's some tailored intervention opportunities there as well. But I'm really interested too, in just hearing some of the conversations in the breakouts around where people think we should focus, particularly I wouldn't say we're coming out of this, right? We know it's going to be a long time before everyone gets the vaccine. But just the opportunity that we have here, right, with the pandemic, and that more people are understanding the tension and the needs that are omnipresent as you try to juggle all the areas of your life, and sometimes putting your own health and well-being second.
And we're seeing a lot of these themes present and expand. Jen, this might be for all 3 of you actually, but do you feel like COVID-19 has sort of accelerated something that we're not going back to sort of doing things the way they were before? I mean, the pressures now are such that it just mandates a coordinated response, that something has to happen. Do you feel like this has sort of brought us to a tipping point of sorts? Jen, maybe we can start with you.
I think in my most optimistic mindset, I do think this actually presents some opportunity for significant change across a variety of sectors. We talk about the need for employers, payers, providers, community service organizations to all kind of look at how their work or their approach to things can be more supportive of caregivers. When you think about kind of how work culture has changed for many people who do work remotely now, the idea that you have a loved one who you're caring for, who you have to go check on in another room, or that you have to go pick up groceries and drop them off at someone's house, has become more water cooler appropriate, if, you know, whatever today's version of a water cooler is in our new world, conversation. So how can organizations embrace that kind of like door opening and move caregiving away from what has often been a bedroom and maybe kitchen table kind of conversation to a boardroom and halls of government conversation? If there's been any opportunity that I see consistently, it's that there is increased kind of awareness that people have these other roles. I don't know that we have all the solutions. You know, I think today's conversations help us identify where there might be those opportunities for change. But I think there's more of a willingness and recognition.
And Heidi, I mean, what do you sense? Are we at a tipping point? I mean, you would also have the perspective of training and making sure that we can work with individuals to feel that they're better well suited to this world of caregiving that no one goes to school for, right? I mean, it's just impossible to feel like you can master it when every day is different.
Yeah, so a couple of things come to mind. I mean, in terms of a tipping point, you know, I feel like there are a couple of things that we're not going back to, right? So I think telehealth as a way to achieve support from healthcare providers without having to move everybody into a single location, I think hopefully that won't go away, right? I think moving much of healthcare out into the community and into people's homes is something we should have been doing already. And now we've sort of proven that we can do it for many sorts of things. So hopefully at that level, you know, that opportunity remains for people who are safer or better served to get that care in their home. I also think that this has raised awareness about what happens when external supports go away, right? So when people have had to make the choice to not have those formal or paid support come into their home. And, you know, my hope is that that recognition will end the sort of notion of the trusted, currently low wage provider that is the home health workers, home health aides, that they receive higher value now because we recognize how essential they are to the well-being of the person with a disability or serious illness, for their independence, and for the health and well-being of caregivers to be able to foster that necessary time apart. And then I also think that at some level where caregivers are rising up as a group to say, we are important members of the team. We've always been important members of the team. And just because you didn't recognize us as important members of the team doesn't mean we weren't. And that it's time to, you know, we have to get past this notion, and I think we'll talk about it later, of, you know, these false barriers that are created in healthcare systems that keep caregivers out of the care team. So I think, you know, some of the work that we're really trying to do at our center is to value those caregivers as it's actually twofold, as essential members of the healthcare team, but also worthy of support for their own needs, not just as a caregiver, but as you said, as a public health mandate, that this is something we have to take care of, this huge population of people who are contributing to the health and, you know, to our economy, right? So anyway, that's enough on that.
Oh yeah, I mean, I'd like to maybe, if we could, turn it to Grace. I'm going to ask you to help triage some of these questions that are coming in from others on the line. We could turn to some of those, but also say that I see a lot of great questions flooding the chat, and we want to figure out a way to incorporate them after, you know, or responses to them after this session. Couldn't possibly get to them all now, but we do want to try to get to them some ways, and I'm hoping that we can also find ways of sharing, you know, the substantive research that you three have done I know, Heidi, in your case, it's not yet published, but how do we, you've done such great work. We need to make sure that people see it. And so we can follow up with that after the call. But great, you have a question or two from the chat that you would like us to bring up, or do you want me to scroll through it and just?
I'm happy to So first,
Yeah,
let me just say,
please.
I'm so excited everybody's using the chat and engaging, and it's awesome to hear from you. Share your resources, share your experiences. We want to hear that, and we want you to be warmed up for when we go into the breakout session. I think the first question that strikes me is, I'm going to paraphrase from my colleague Marianne Sterling here, but essentially, what's different about high intensity caregiving situations like Alzheimer's? How is that different than what other caregivers are going through in the midst of COVID-19? And I don't know, so Jennifer and Heidi, I know y'all have, Jennifer, you've done a lot of work, obviously, with the reach intervention and other Alzheimer's supports. And Heidi, I know you've worked in the field a long time. Maybe if either of you have perspectives on, what is it that makes dementia different when we talk about COVID-19 or other conditions that are really have that medical complexity?
We have two kind of categories of experiences that we've seen, kind of high intensity challenges around dementia being one, and the behavioral aspects of what COVID means as far as distance and masking and all of those challenges present some really unique issues and creates caregiver stress like no other. But the other place where we see a significant impact is especially veterans with post-traumatic stress or other reasons to adapt behavior, and what that means from a readiness standpoint, and what all of that triggers for the caregiver and the household. So I think we're especially focused on those two populations of caregivers, and thinking about what would be necessary and what can we recognize from this pandemic that might be useful for supporting caregivers in natural disasters or other events where behavior change is going to be necessary, and that causes a burden on caregiver populations for those they're trying to engage in that behavior change.
Thanks,
Yeah,
Jennifer.
I'd echo those two. I mean, the behavioral and the cognitive as two separate and often additive sort of factors that makes it more difficult. I also think, the intensity of the care and the impact of taking away the previous supports that COVID has really caused. So, we saw a lot about sort of the number of people being involved in caregiving suddenly being very reduced because of decisions families had to make about exposures to an at-risk elderly individual. I also think the other thing that I think is really important that I think we often neglect in caregiving is those younger caregivers, which came up in so many different ways that we sliced and diced the data. So younger caregivers who are caring for their parents, younger caregivers who are caring for their children or adolescents or young adults with emotional or intellectual disabilities, who they suddenly had their independence taken away that they had through school or other programs, and now they were at home. There was the anxiety and, again, the behavioral issues. So I think for that group of caregivers, and oftentimes those caregivers were doing both, right? Caregiving for an older adult and caregiving for children. So some really unique stressors there.
So what about a really interesting conversation in the chat about social supports and sort of the advantages of virtual supports versus people just being zoomed out, and they don't want to they don't want to be on another virtual happy hour. Or I'm wondering, Jasmine and Greg, if you have any thoughts, and then Jennifer and Heidi, you're welcome to weigh in.
I continue to think, and I'd be curious if this bears out, that I'm drawing more from my previous colorectal cancer advocacy experience, where we saw that some people really do want to see each other. Some people are pure voyeurs. Some people want to listen to a podcast. But I think it's like all of the above, but just offering an outlet and knowing people are going to sometimes come in and out of it, right? Like you've got people that are the steadies who are going to be there for every time that there's a meet, and some people are just going to come out when they've got a high intensity thing that they either just need to connect with another person who's going through a similar experience, or be brave and, you know, kind of raise the flag and get some advice on. But I'd be curious what others would say to this.
Yeah, Greg, Jennifer, Heidi, do you have any other thoughts on the Zombies, as I've heard them called?
Yeah. So it's interesting in the world of cancer caregiving, where I started and continue to be active. There are a lot of national organizations that are really preparing to not go back to in-person support groups because they've seen attendance increase dramatically. Primarily because people are able to both stay at home where they don't have to worry about leaving, and really finding it to be a safe, comfortable, convenient way to interact with other family caregivers, which they say they are not able to do in their local communities, and especially if again, I think probably what we'll see in those rare conditions, maybe Greg, like you're talking about, are places where there aren't established support groups. It's an opportunity for people to connect with people that they feel are like them, and that matters. I think that to be able to sit in a community of people who are going through very similar things.
So, Greg, go ahead.
No, please.
I think one last question before we head in the breakout group, and this is something at NAC we've made a commitment to, which is recognizing the impact of race and ethnicity on the way we collect data, the way we do research, and how that informs what people in Washington do, or what people in the field do. And so I'm wondering, Jennifer and Greg especially, can you talk a little bit about, collecting that diverse data? I think, Jasmine, you also had pretty diverse sample, as well as samples of people who are caring in other nations. So I think before we head into the break and then the breakouts, it'd be helpful to know, how do we really capture the voice of caregivers who aren't your typical caregiver, but who are on, part of the caregiving ecosystem? Greg, you want to kick us off, and then we'll go to Jennifer?
Sure. I mean, I always feel like legislators, appropriators, they like things that they can count. They want things that they can measure, and they particularly they will particularly pay attention to trends over time. And if things appear to get worse and there's data to back it up, they'll likely consider action. But at the same time, as you mentioned, Grace, it's that aggregate of data doesn't do anything for the individual and the individual's point of view, the individual caregiver story. It's the raw experience of the individual's journey through these issues that really compel people into action. And if we don't have a vehicle to capture those stories and points of view and share them so that they apply hopefully into action, it's difficult. So if just even by starting here, by collecting voices and stories, people may have suggestions here on this call about how we can continue to capture each one of these stories and perspectives so that we can channel that into a collective voice for action. But Jen, I defer to you.
Yeah, I mean, we, like many organizations, do surveys that are based on online forms that people fill out, which gets to only a certain subset of the population, both race, income, even broadband access. And so, while we had our findings from this Caregivers in Crisis report, we've also recently undertaken an approach which we're calling care calls, which are localized conversations with caregivers, primarily Black caregivers in rural communities here in Georgia, to engage in conversations to even say, like, what would be a way, an online survey may not be the tool, but it's important for us to understand what's going on. What are the methods and approaches? So it's not even necessarily a data collection, it's a how to collect insights and data appropriately conversation with caregivers who are stretched thin, but also who do have points of joy and things that they want to share about their experience with other caregivers. So what's the format for that is most appropriate and enables the broadest range of voices?
Yeah, and Grace, just to bookend what Jennifer's point has been, I would say that we need to involve the communities that we want to represent right from the very beginning, right? And creating the surveys. I mean, that's just been my time and time again, lesson you sometimes relearned, but I would emphasize that point. And then we also just spent extra resources to look at augmenting with the telephone calls. And I had wanted desperately to do paper, but because we were doing 12 countries, that became problematic. But again, I think there's many ways that we have to come at this.
Thanks, Jasmine. Heidi, you want the last word?
Oh, I guess I would actually throw it back to you, Grace, of really saying thank you for your ongoing efforts to bring, just such a wide variety of stakeholders together to have these conversations. I think we're all learning so much from one another. And I think learning how to think about what are those general needs that all caregivers face, and then where are these pockets of risk that need more attention, need more research, and more support. So thank you for your valuable efforts.
So, Greg, I just want to extend a round of applause. If you're near your emojis, you can do the clapping hands. I'm going to be old school and do my round of applause to you and to Jennifer and to Jasmine and to Heidi. Thank you so much for your feedback. Okay, well, we are back at the top of the hour. It is 4:10. And this is the really exciting part of the meeting where we get to talk with you, because all of you are the experts here. We've got a really great group here. We've got folks who are taking care of somebody. We got folks who provide services for caregivers. We got people who advocate for caregivers in their life, people who provide products or services, and even a couple of folks that receive care. So pretty powerful to see such a wide group, and the fact that so many of us may be playing multiple parts of this role from time to time. The other thing you'll see on the poll, if you scroll down a little bit, is under question 2, what's the biggest impact COVID-19 has had on your life? And we see, many of us are working or learning remotely, roughly 6 out of 10. And then you can also see there's other impacts, people who have had to leave their job or cut their hours, feelings of loneliness and isolation that came up earlier, finding it harder to take care of someone. And then there's some positive sides to this, strangely enough, having more time with the person I care for. You can see about 17% of folks who took our survey here said they actually have better access to online activities and services because of the pandemic. And we have a couple of folks that responded other. So if you were in that situation where you said other, we'd love to hear from you in the chat. If you want to share what you're doing, it would be great to hear a little bit about that. And an important point, I think, one of our colleagues here has provided some additional background on that I need care, and said, part of this is about self-care, about being able to find care for yourself as a caregiver. And that is a great segue into what we're going to be talking about. I do want to show you what we're going to do in the breakout rooms, and then I'm going to hand it off to our breakout captains, and y'all are going to get down and discuss, debate, engage, and really tell us what we know and what we don't know and what could be better. So the first part of this framework is going to be essentially put into a document that we can share with policymakers, doctors, healthcare systems, that we can describe at a glance. These are the road bumps when caregivers are trying to navigate COVID-19. So when you're looking at this first one, you want to be thinking about, are these the big road bumps? What's missing that's not on here that's a major road bump? And you can see that we have sort of in the blue situations facing all caregivers. In the lighter blue, we move into some that seem to be a bigger pressure for people who are in the same home. And then the red above that is the impact of someone with mental illness or cognitive impairment. So imagine this is something that we're sending to a member of Congress, we're sending to people in the president's administration or others. Is this communicating what we need to tell them? You know, when we're making that case like, hey, we need your help. If you go to the second page, Charlotte, the second piece of this is we're building a website that will make it hopefully easier to navigate all the different services that you might need or want in order to navigate COVID-19. And we've split this up into categories. How do you take care of yourself? How do you take care of people, whether you're in the same household or not? And how do you take care of someone who is in your same household? And so that's the second part of this framework is, you know, does this make sense to you? Are these the types of resources that you would be looking for? Or is the wording the kind of wording that you want? So that's kind of an overview of what we're going to do with this. And we're going to take all of your feedback. We're going to have a global town hall meeting, just like this one, in a couple of weeks. And with our steering committee, we're going to actually begin to build out this map to make it easier to get the information that people need during this time. So with that, I'm actually going to ask my colleague, Charlotte Davidson, who I believe is, I'm looking in my Hollywood squares.
Sorry, I forgot to turn my video back on.
Charlotte, it's great to, so first off, if you don't know Charlotte, Charlotte is our fearless leader behind the scenes and has been just a tremendous like force behind this project. So Charlotte's going to talk a little bit about the logistics of the breakout rooms and where folks are going to go. And then we're going to break out, we're going to come back around 4:40. We're going to hear the top 3 insights from your breakout group. And then we're going to take all of that. I want you to go home, think about it, chew on it, and we'll be sending out a follow-up email at the end of the week so that you can continue to provide feedback of things. You know, you're out watching holiday movies and then you think, gosh, there's something else I wanted to say. You will have that chance. So on this group. So I think we have about 28 people in this room. So I'm going to ask if you're interested in participating in the discussion. Charlotte, if you can move it back to the first screen here.
Yeah, sure.
The question is, you know, are these pain points, do these pain points make sense? You know, what's missing from these challenges? So would love to hear from you guys, and we're going to open it up. So Monica, I see you raising your hand.
Yeah, I think it would be helpful. I love this framework, but I think it would be helpful, and I'm going to focus on technology because I helped draft the first comprehensive telehealth legislation here in the state of Florida. And we did that in 2017, 2018. We took testimony from over 100 different groups across the state on how they would use telehealth. And lo and behold, you know, that all of our work now becomes so valuable because of what's happened with the pandemic. But I think when you talk about technology over here, it's going to be really helpful if you really talk about access first. So even though we say telehealth, electronic health record, all those things, the fundamental missing part right here is that, you know, broadband has to be treated as a commodity like electricity and water and those kind of things. So I think you need to boil it down to that, because for a lot of seniors, seniors in congregate housing, they're not going to have access to the internet services. So all of that becomes really not that useful to their caregiver.
Thanks, Monica.
Sure, my pleasure.
Is it Myra Parada?
Thank you, Grace. Yes, Myra. Piggybacking on the access issue, obviously access to broadband is a utility, and so that needs to be front and center. But I would also suggest, in terms of the pain points, to make the economics or the income its own bubble. Because if you want to really make an impact to policymakers and people who are making decisions, we have to bring the income issue front and center and make that its own bubble. And maybe even the access to technology is related to that as well. Of course, safety issues and housing and food are related to that, but I think to make the economic its own bubble, economics or economy and jobs.
And just a clarifying question, when you say economics, do you mean the caregiver's finances or the finances of the person who's receiving care?
The caregiver's finances. As we saw from that very first slide, in terms of how much of our personal income is going to the care and things that are not covered by a number of things, especially when you're treating someone with a complex condition. There's lots of things that are not covered. And because you're not able to work a normal job, which was my case in particular, savings begins to go, retirement funds begin to escape. And that's not obviously reimbursed or compensated in any way. And I know there's a lot of low income people who are burdened, of course, by the economics, but there's a lot of people like me who have degrees and have, are credentialed enough, but it's impossible to really be able to work a full-time regular job and care for someone with complex needs.
Thanks, Myra. I see Lisa and then Shepherd.
Hi, Grace. So I think that somewhere along here, and I'm trying to read and zoom in and make sure I'm not overstating something, but it's something that came up in the chat and something that we've certainly seen at Caregiver Action Network. And that is the decision point now, either during or even in a post-pandemic world, about whether or not your loved one should be placed in a congregate setting, whether that's skilled nursing or some other retirement home. Our research is showing that that is going to be a really key driver of increased caregiver stress, as more and more people are going to make the safe choice to keep their loved one home longer, which is going to have increased caregiving burdens. And then what are we going to do in terms of policy to suggest solutions so that the supports that would be necessary for the care recipient could then be provided in the home if that's indeed the choice that's made? Some sort of transition that's not a hospice model, but provides that level of care support in the home if somebody chooses not to use, say, a Medicaid benefit for a nursing home placement. So I think that nursing home placement decision definitely belongs on this journey map. And of course, it has serious implications for self-care for the caregiver, for home modification, and for finances.
Thanks, Lisa. Shepherd.
Yes, thank you. Well, I want to just respond as far as economics. I'm a caregiver for my wife who has Alzheimer's, and I got furloughed right at the beginning of March. And at the same time, my wife, who goes to the Baker Ripley Dementia Day Center here in Houston, Texas, they had to close. So all of a sudden, I was furloughed. I could get unemployment, but then at the same time, I was then, full-time caregiver for my wife. And, I wasn't going to be able to get any kind of job that would be outside of the house because I wouldn't be able to take my wife and I wouldn't be able to, leave her at the house. So, those things, the unemployment that they extended and the additional benefits helped significantly. And just like that other lady who mentioned about having to withdraw from my my funds, I'm fortunate that I was able to put, a good amount of money where I'm comfortable. But, I had to decide that I had to start my own business, my own consultant business. which you could do remotely. I had to learn how to work from home. And then fortunately now in the last couple of weeks, Baker Ripley has been able to open up again. And my wife is going 3 days a week, which is giving me it will give me the opportunity to go ahead and get back into the workforce. But that's something that affected the economics about, because our place that we would go to had to close because of the COVID-19.
Thanks, Shepard. So I know I see Maggie and is it Ariel Green? So let's do Maggie and Ariel. And I'm wondering, as we're doing this, so I'm taking notes, but if there's someone that wants to be the designated reporter, don't be shy. Feel free to volunteer in the chat box and give the highlights. So Maggie and then Ariel, and then we'll go to the second part of the framework.
Hi, thanks. So one of the comments that I have looking at thinking about housing. So housing is listed here in one spot, but we know that most care happens at home by family members, and the level of the household often really gets kind of left out. So there's this assumed home where care can happen, and all of that responsibility to maintain housing falls on caregivers with very little attention paid. So first of all, the financial piece of that. I became a caregiver for multiple family members, my mother and my grandmother at 17. And if we didn't have secure housing, I mean, we all would have been on the street. Who knows what would have happened? The government would have been paying hundreds of thousands of dollars for their care. Instead, I shouldered all of it, right? And didn't get anything in return, right? So some kind of housing subsidy or social security credits or like the big stuff that would help. And I'm a public health geographer, and my research really shows that this household, the relational aspects of managing services that come into the home is really ignored. And so there's this discourse that people don't use services because they don't self-identify as caregivers, which I really, I disagree with that. I mean, we know that people don't identify, but people try to get services, and they're so invasive. And I describe it as throwing caregivers to the wolves in a lot of ways, because there's all of this management and extra work that goes into managing services. And people want respite in the form of taking a bath or sitting on their couch without having to take care of someone, and they can't do that when they're providers in the house. So I think that needs to be kind of brought up more often.
Thanks, Maggie. Ariel.
Hi, so I am the caregiver support specialist at Baker Ripley. So I kind of want to just piggyback on what Shepard mentioned about the lack of support in terms of centers and resources being closed. The other thing I wanted to add to that is now that the center is back open, some caregivers are facing barriers in terms of accessing assistance with paying for respite through adult day centers because changes in policy. So the Harris County Area Agency on Aging provides respite care in the form of adult day and in-home. Well, they have made a decision to only provide in-home care for whatever reason. And as a result, that impacts people's ability to be able to pay for care. So not only the center was closed and now it's open again. So that's one thing, is the lack of resources, and people are not able to work. So how can you be able to find a job if you don't have the resources to be able to pay for care because of certain policy changes and procedures, whether it's on the local level or state or federal level? The other thing that I wanted to add is the differences with Medicaid. Like, if one Medicaid program, it varies from state to state. So it's not always clear. You can live in a different part of the country and receive better benefits. And if you're in, let's say, Texas, where the Medicaid program is very limited, and if you make a certain amount, just $1 over, you're not eligible for services. So that definitely impacts people's ability to be able to care for their loved ones and decide whether they want to do in-home care, or adult day care, or nursing home. And so it's a big challenge.
That's great. Thank you for that. So let's go to the second. So I've been taking some notes here. I just want to, Sarah, I want to give you a chance. I see that you've added a comment here. Sarah, if you want to chime in. I'm looking at your Hollywood square, although you can't tell that, but.
Yeah, okay, sorry. And I didn't have my little raise hand icon, so sorry about that. I just want to echo some of the things that people have already said, because not only do I work for an organization that helps support caregivers and care for those that need it, but also personally doing that for family as well. So I have so many different things to add to this. I think the big thing is that families go into crisis before they realize that they need some kind of support or care. So the only thing I could think of is some type of a navigator, even at the physician office level, would be really helpful. A lot of times your first reach out is to physicians, your primary care doctor, your specialist, to help navigate some of that, that world. And then I have quite a bit of frustration with trying to get my mother-in-law on Medicare for home care services, and tried to get her through the PACE InnovAge program. And I have issues with that. Seniors have to drain their resources to qualify to get onto Medicare to get those resources. I understand that the program's meant to help the vulnerable population, but it seems so restrictive that I would like to see our elected officials take on, widening maybe some of those efforts. It just doesn't make sense to ask them to drain all of their assets to get some of the care and to manage that as a family member, when the person that needs care probably can't even comprehend what they need to do to get that care. If that makes sense.
Yeah.
So Wendy, I didn't know if you wanted to weigh in.
Oh no, I totally sorry. I so agree with what everybody's saying. You don't realize you're a caregiver until you're actually done in crisis, well into it. Everything's upside down, and you're like, "What's this caregiver?" I mean, I tell people today, and they're like, "What's a caregiver?" And I'm like, "Wow," like I never heard of that. But yeah, just recognizing people at doctors' offices, even the elder services, recognizing you're a caregiver. Here's your road in front of you. Here, not just like what you guys said, not exactly what it is, but here's the, the help that you need or whatever. It's just, it felt like, and I've been doing it now for about 10 years, and I'm a single mother of 2 kids as well. So, we all live here in the household, and it's like nobody sat down and said, here, nobody knew what to do. And it just felt like, what is this? Nobody at the elder services, nobody knew what to do. Like Sarah was saying, my parents were over by $100. But and I'm in Massachusetts, if they were divorced, they both would have got on the health insurance. So I'm writing to all my elected officials at the time, do my parents really need to get divorced to be able to get health insurance? And they're all sending me back 1-800 numbers. And I'm like, so just more, they need to be more informed, as what this population is as caregivers and what we actually go through. And when we don't have the resources or the money, that other people might have, or that the insurance that they might have, like, this is what we're living. As a single mother, I get paid to take care of my mom. It's not an income, but it's sufficient. But at one time I was getting nothing. And I can't go get a job taking care of 2 people. And, and this is exactly what I told the elected officials as I was working, like, listen, can somebody help me, please, before I lose my job? And, then you guys are going to complain about me losing my job. Like, it just felt like I was stuck in a catch-22, no matter which way I went. And it took 3 years to get my parents on health insurance, a 3-year fight, but thank God they did. My father has since passed, so I was caring for him in a facility and my mother here, and had my 2 kids. So I definitely see the number 2 room where you have to care for 2 things. But I think more of our elected officials need to really understand what crisis we are in. And, it's going to hit so many more people. And I'm seeing it with like friends, and it just happened to hit me early with my 2 parents. And I'm seeing my friends now getting into it. Like my friend's father-in-law fell the other day and broke his hip, and she owns her own business and she has 2 kids, so they really need to recognize sorry, I have a bird.
No problem. No, Wendy, that's
recognize, and we had, again, Maggie said the housing. I have 2 kids. It's Christmas. I have my mom here. Now I have to worry about keeping the heat on. Do we put up our Christmas tree? Because that's extra lights. Do we decorate the front of the house? Because that's extra light bill. You know, these kinds of issues, like, and this is my kid's life. Do you know what I mean? And you, as a caregiver, you're thinking, oh wow, do we really put the Christmas tree up early because that's going to put up the electric bill? Do we do this because it's going to affect different things? And I just want them to realize what we're going through and the choices that we have to make. And not only are we worrying about our loved ones' health, we're worrying about keeping the lights on, we're worrying about keeping the heat on. And it's great people tell us, oh, well, there's this program and that program. Well, we are running around with our heads cut off. We can find out about any program ourselves. We need people to actually say, hey, sit down with me and we're going to fill out this paperwork together. Right. Do you know what I mean? You can hand me all the paperwork. It's just going to stack. It's going to stack in the pile and it's just going to get ignored. And then, and then I'm going to be in another crisis and then I'm going to go search for it, be like, where's that gas bill?
Wendy,
so like, I did that.
No, thank you. No, I think that's really helpful though, and so we have to close the breakout rooms, but I think that point about how do we create something actionable so that you're not having to fill out all the paperwork, right? So that it's easier. Now, I'm wondering, I threw it out there a minute ago. Do we have a volunteer that would like to summarize for our group the highlights?
I could try.
Okay. All right.
I do, but I don't mind trying.
Okay, Wendy, you are going to summarize. I know I put a couple of notes here in the chat, and you'll see there's a couple other notes that I know folks are going to filter in. So we're going to go ahead and mute everybody. But I'm going to say for the first room, let's go ahead and unmute. Is it Marilyn and?
It's Marilyn and Emily, yeah.
So Marilyn, you're unmuted, and Emily, you're unmuted. If y'all want to give us your top 3, your highlights or takeaways from your breakout session.
Well, I can start, but I'm sure Emily shares our appreciation for everybody who was in the room. We could have talked with them and heard more stories, personal and other. I would say one of the top areas that I heard was the concern around isolation, which comes as no great surprise. I think isolation is pervasive. I think it happens during COVID-19 and after, but certainly caregivers are subjected to more of it during COVID-19, I think, where it's become more apparent than in other times. So I heard that very clearly. I also heard, which I thought was interesting as well, is the concern around how people have to think about potentially putting a loved one in a facility, given the burdens, the agitation that sometimes exists, the frustrations, the physical plus the cognitive care. It comes to that point where you have to make that determination. With COVID-19 having a presence, no one really wants to think about the option of putting a loved one in a facility. And I think that can be very overwhelming. So that was something that I heard very clearly in our piece. And then quality of care came up, which I thought was interesting too. That understanding that telehealth is very much in existence here, but it doesn't always fit the need. The reporting may not be accurate. The communication, the technique itself. I think all of that is something that is concerning at this time, because certainly with the pressures of not being able to go out, with the care that is expected, and with not, having the kind of diagnosis options that you would typically have, that is an additional burden to the caregiver and to the patient, clearly.
Thanks so much. Yeah, Emily, do you want to add anything?
Sure, yeah. One big thing that came up was the difficulty of managing the what ifs right now, because the what ifs are suddenly so much more stressful than they ever have before. And and not only managing COVID fears for yourself, but also the person that you care for, and by extension, every single person that both of you come into contact with, and the pressure of that. And then also, caregiving can be traumatic, and having to make some of the decisions that you have to make can be traumatic, and the importance of calling that what it is, that caregiving isn't just something that's, you know, kind of tough. It's really genuinely traumatic to a lot of people.
Thanks so much, Emily. So let's go to David and Jennifer. If you want to go ahead and unmute yourselves.
Hi, so I'll go because I typed up the notes.
Cool.
Yeah, so we spent a good portion of our time actually on the first question, which was just sort of the first impressions that folks had on the framework itself. What came up was just seeing that there is a lot of information on the actual layout of the framework. So there are some suggestions on how to make that a little bit more clear. There's a little bit of confusion around whether it was linear or a continuum or something that could display something that was more intertwined. So that was a point that came up. Another suggestion was clarifying the components or the challenges that caregivers have when caring for someone with a mental health disorder or a cognitive disorder. Right now, it currently looks like those 3 points are separate from the rest, while those can be additional experiences that that caregivers may have. So implementing something that would combine that or make it just more clear that those are additional. And then let's see, Jennifer, if there's anything else I'm missing, those were my 2 biggest points that I wrote down, but if there was something else, and Lauren was in there too. So if Lauren, you're welcome to share something.
I was going to chime in just content-wise. People mentioned they thought was missing emphasis on how to navigate workplace considerations and economic hardship as a result of COVID and caregiving.
Okay. Thank you so much. Okay, Trish and Maggie, you're up.
Hello. So I was trying to, we had a great conversation, and I was trying to condense the notes for this discussion. But overall, everyone was very positive around the framework. So great feedback around the framework. There were a couple suggestions similar to what I think we've already heard. One thing that we focused on were access issues, which sort of leads to, so it started around talking about school, but actually in the framework, but actually even more issues. And what happens is, these safety decisions that we have to start making become more complex, right? So it's not as simple as, well, if you aren't going to school, to a physical school, then you're home and you're virtually learning, right? Not everybody can be in that situation. So there's assumptions there that there's the, either or, right? And then services for, safety decisions around services for yourself, right? You're as a caregiver, you're making decisions now to maybe not get the health care that you need because you don't want to expose yourself and then come back into the home and expose your family members in any way that's going to increase problems with COVID. So that work-life balance of making decisions is really hard. The other piece is around disease progression, right? So we're talking about that the disease progression is compounded by COVID, and people might not realize that because lack of access to services means, you might not have a BiPAP when you need it. And if you don't have a BiPAP for 6 to 7 months, what does that mean? And what's that impact on the disease that, you're caring for your loved one for to begin with? And that increases stress, right? So it increases stress for the caregiver, that increases stress for other family members. It just increases stress, period. That's what I heard throughout a lot of the notes that I took. The other thing that I heard, we were talking about paid family caregivers and the issues there, and some of the barriers to access for those Medicaid waiver programs, and what could be done and what could be shown maybe in this framework or in the discussion with policymakers. So there's the Medicaid waiver programs, but the thresholds for access is different in different places, right? So people can't get paid as caregivers, so they're working a job at home, or they might be working 2 jobs at home to be able to make ends meet, and still trying to take care of their family member. And then we were talking that part of that also led to some people do not have jobs. How are you going to be able to apply for a job when you're trying to take care of somebody at home, when you don't have access to all the services that you need, that you had access to? And even then, we all admitted that even before COVID, we didn't have the access to those services as much as we felt we should have. So now COVID's sort of like made that like 10 times worse. But, you know, someplace easy where you can find out, you know, what benefits exist, how do you apply, how do you qualify, how do you maintain it, make it easy to maintain. So remove those barriers to access that keep coming up, that keep getting thrown up, that I think in some circles, when you hear people talk, they think that those are good because somehow they feel like somebody's taking advantage of the system. But in other circles, people don't understand what the system really is doing to prevent that from happening. So I have 3 pages of notes to type up for you.
That's awesome.
If anybody in our group has something to add, please do.
That's awesome. So our group, we ended up with the 4th breakout room a little bit by accident, but I think it worked out well. And I deputized Wendy and her bird as well. So Wendy, I want you to give us the top 3 from our discussion out of the group. And I also just want to say, continue, folks, if you've got other things that you want us to think about, go ahead and put those in the chat box as well. But Wendy, the floor is yours. Let's see, you might be on mute.
Okay, I think we did it. Okay. I think we talked about, no, now you put me on the spot here. We talked about basically accessing like health care, and then also the respite for adult, the day house and stuff. And yeah, that's where I'm at.
That's awesome. No, and I think Wendy,
technology. I'm like in technology. All right, that's 3. Yeah.
That's right. Anybody else from our 4th breakout room want to chime in or add something? Jane Hamilton, if you can unmute yourself.
Okay, great. The one last thing that I would add is that Wendy gave us such an animated full story of her situation, and it struck me as I was listening to how compelling that story is. And somebody earlier in the first session talked about the collective voice for action, and I think using story as a part of the presentation will be important.
Yeah, you know, one thing I wrote down too that I thought was interesting is not just this pressure on work, but that ability to re-enter the workforce. And it's not just about like your housing security, but your ability to, you know, when you're having to make these tough choices between like, am I going to pay my light bill or am I going to pay for medications? You know, and I think that making that it's not just financial strain as in I can't afford Starbucks, but it's, you know, these really dire choices that families are being put in and really confusing as to how you can get financial help. So, well, we are right at 5 and I am committed to ending on time. But let me just say, I am so thankful for all of your insight, for our steering committee, for the partnership with the Adira Foundation, for our fabulous speakers. We are going to provide an additional follow-up email later this week and we'll include a microsite where you can actually go and provide more feedback. So I want you to, as you're going about your week, as you're going about this month, continue to think about what worked, what didn't work, what would be useful to you. And we also are going to want to hear from you what resources are helpful, because as we're building out this Wikipedia of caregiving, we want to know what should be on it. So thank you so much. Thank all of you. Y'all have a wonderful holiday season, and we'll be in touch soon.
Thank you as well.
Thank you. Thank you so much.
Thank you.
There you go.